Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Microscopic polyangiitis and the granulomatosis with the polyangiitis. So both the microscopic polyangiitis and the granulomatosis with polyangiitis, they are small vessel vascularities. So they are nothing but the small vessel vasculitides, and they are mainly called due to the ANCA. So ANCA stands for the anti-neutrophil cytoplasmic antibodies. Therefore, they share as common clinical features with some differences. So let's first look at the microscopic polyangiitis. So in terms of the microscopic polyangiitis, the vessels affected, it includes the small and the medium vessels, vasculitides. Then looking at the organs which is involved, it includes the lungs. This can present with the hemoptysis. And then there is also the involvement of the kidney, there is a GIT, then comes the presence of the skin, there is a cutaneous vasculitis, as well as the nerves. So under the nerves, there is a mononeuritis multiplex. Next, we look at the upper airway involvement. So in terms of the upper airway involvement, what do we have? So upper airway involvement is actually less. It is less common. And looking at the nodular cavities in the lungs, you look at the nodular cavity. The lungs and nodular cavities, it is absent. Then in microscopic polyangiitis, what about the ANCA? So looking at ANCA, that is anti-neutrophil cytoplasmic antibodies, there includes the PANCA, which is mainly present. Then let's look at the granuloma. So when you look at the granuloma, it is absent, and looking at the necrosis, it is also absent. Then when you move on to the kidney, it is glomerulonephritis, that is known as the GN. Next, we go to the granulomatosis with the polyangiitis. So here the vessels which are involved, it includes the small. It mainly involves the small vessels, vasculitis. Then what are the organs which are involved? The organs involved is the upper respiratory tract, URT. Then it includes the lungs that presents with the hemoptysis. Then there is involvement of the kidney, there is the eye as well as the skin. Now what about the upper airway involvement? The upper airway, if you see involvement, it is more common here, and that is there is involvement of the sinusitis, there is otitis media, there is hearing loss, as well as the septal perforation. So sinusitis, otitis media, hearing loss, and the septal perforations. Now let's move on to the nodular cavities. So nodular cavities which are present in the lungs. So when you look at the nodular cavities in the lungs, it is present. And what about ANCA? The ANCA, it is CANCA, which is mainly present. So in the microscopic polyangiitis, it was the PANCA, and granulomatosis with the polyangiitis, it is the CANCA. Now, what about the granuloma? Granuloma here is that it is present. Then when you look at the necrosis, it is also present. Then looking at the kidney, it shows glomerulonephritis similar to that of the microscopic polyangiitis. To learn and grow daily like this, please do subscribe.